Hi, I am Dr. Stacy Plichta, Professor of Health Policy and Management at the CUNY Graduate School of Public Health and Health Policy. And today we're going to talk about financing healthcare in the US. Where does the money come from? And then later we'll talk about where it goes. This class will help you to describe the organization, structure, and function of the US healthcare delivery system in terms of financing, insurance, payment systems, and healthcare delivery. It will help you to explain how healthcare is financed in the United States and to describe the flow of money from households to healthcare providers. We're going to base this in the She-Quad function model. In the She-Quad function model, the healthcare system is described as having four components. The first component is financing. This is where all the money is pooled. And then from financing, most of the money goes to the insurance component. A little bit of it goes straight to the providers. The part that goes to the insurance, there's a payment mechanism to get the money to the providers. And we will talk about insurance payment and delivery in future lectures. Today, we're going to focus on financing. Now, financing is the component that provides the money to pay for healthcare services. According to the World Health Organization, it's the function of a healthcare system that's concerned with the mobilization, accumulation, and allocation of money to cover the health needs of people, both individually and collectively in the health system. So, what does healthcare financing look like in the United States? How much money are we talking about? Well, in 2003, we're talking about $4.9 trillion. That's about $14,570 per resident. It's 18% of the United States total gross domestic product. The amount of money increases each year, but the percentage of the gross domestic product has pretty much stayed constant, although future projections have it creeping up to about 20% by 2030. But how much is $1 trillion? We economists throw out these numbers all the time, but they're hard to visualize. So let's do it in $100 bills. If you had $1 million, you won a small lottery. You could stack up those $100 bills, they'd fit behind your chair. Well, let's say you won $1 billion. That in $100 bills would stack up higher than the Burj Khalifa in the United Arab Emirates, which is currently the world's tallest building. Little, about 0.63 miles, almost 2/3 of a mile. Now, $1 trillion, that gets us into space, 2.5 times as high as the International Space Station, and 4 trillion, much more so than that. So it's just to give you a sense of what a trillion is. And how does this money flow? Well, basically all of it starts out in private households. Some of it is state and local taxes, some of it's federal taxes, that includes payroll taxes, and that money goes to state government and federal government. Some of it comes from private households through private employers. It's cuts in their paycheck. People get paid rather than in money, they get paid in benefits. That goes to private insurers. And then there's money that comes directly from private households to purchase health insurance, to pay for co-pays and co-insurance and meet deductibles, to pay for Medigap policies, for out-of-pocket expenses. And then there's some other private spending from private foundations and charities. So the money flows from households. Some of it goes to state government. That largely goes to Medicaid, although some other programs as well, including public health, which gets in remarkably small percentage of this money. A lot of it flows to the federal government, and that gets paid into the system to providers as Medicaid and Medicare. Some of it comes through private health insurers, and that, again, gets paid from private employers through households. And then some of it comes directly. So this is essentially the flow of money from all of us in our households to our healthcare providers. So where does the money come from after it leaves our household? Because that's where it starts. About half the healthcare in the US is paid for by federal, state, and local government. So when folks say they don't want socialized healthcare, they don't want government in healthcare, it's already there. About 27% of it really does come directly from the household. 17% comes from private business and 7% from other private funds. And where does the government share come from? The government share, about 46% is from individual income taxes, general revenue. About 36% is from Social Security and Medicare. Those are those payroll taxes that we all pay. 11% comes from corporate income taxes, 3% from other taxes, and 6% from estate and gift taxes. And what's really interesting, now that we know where the money comes from, is looking at how the payers change over time. So remember, while all the money initially comes from our households, it gets divided up, right? So some of it goes through private insurance, some of it's out of pocket, some of it goes to Medicare and Medicaid, some of it comes from other public health insurance, think CHIP, um, Children's Health Insurance Program, other comes from other third-party players, public health, and then think, investments, think private hospitals, things like that. If you follow the red circles, if you look in 1960, you'll notice there's no payers for Medicare or Medicaid because Medicare and Medicaid were not established until 1965. The red circle, starting in 1970, is essentially how much money the government was paying. And if you look over time, the percent of money paid by the government increases dramatically. The percent of money paid by private health insurance increases dramatically. The percent of money paid out of pocket goes way down from 47% in 1960 to about 11%, really 12% in 2012. And I've got some more graphs. This stays pretty consistent. So what happens is government becomes a big payer, insurance becomes a big payer, out of pocket shrinks dramatically, and the others stay relatively stable. So if we look at this more recently, and again, the circles that are being shown, that's the public money. And remember, you can always stop the slides and stop the YouTube or take a look at the slides and really study these. But you can see over time how um, the federal payer, health insurance it becomes a slightly bigger payer by 2027 projected, but it's really Medicare. It's really Medicare and somewhat Medicaid that increases greatly. And again, just another way of looking at this to show you what the mix of payers look like. Bottom line, though, is that the expenditures on healthcare have steadily increased each year. So the financing needs to increase. If we look at overall expenditures from 1970 through 2020, we can look at it as a raw number or in constant 2020 dollars. It doesn't matter. It just increases, really takes off after 95, but it's still increasing. The rate of increase has slowed down, but expenditures are still going up. What's interesting, you could say, well, everything's going up, right? Everything got more expensive. But if we look at the consumer price index, you can see that the increase in medical care, a cost of medical care, is significantly higher than the increase in the consumer price index for all goods and services. And we can say, okay, well, why? Why is medical care going up so much faster than the cost of everything else? There's not one reason. There's a number of major factors, and I'll take you through them one by one. Major factors include the increasing unit prices of medical services, fancy way of saying that we're paying more for services, more intense levels of service provision and more sophisticated medical technology, more intense levels of service, meaning longer visits, more complicated visits, cost more. We have a bigger population. That drives up the overall costs. Our population is getting older. Older folks use more healthcare. And private insurance and hospitals have significant overhead. And also, we're just willing to pay more, especially we're willing to pay more than other countries for healthcare. So let's look at unit pricing. If we look at the eight components of the Consumer Price Index since 2000, um, everything except clothing has really gone up, right? It has really increased in price. But what stands out? If you look at the graph, it's medical care. Medical care has gone up much more so than anything else. Other goods and services slightly, behind it, as is housing. But really, through 2020, nothing was as high as medical care. Those other things are catching up. The second reason, intensity of care. So if we look at, this is a little complicated, so I'll take a few minutes to explain it. Level one visits are very quick visits. That's a blood pressure check. Level two visits are also fairly quick. They don't that might be getting a vaccination. There there's not a lot of intensity of care. Level three visits are what you would think of as like a typical standard doctor visit where you go in either with an acute problem or for an annual wellness check. Level four visits are more intense. Provider spends more time, provides more services. And level five are those very intense visits where a lot of care is given. You typically wouldn't see that so much in office and urgent care. But if we look over time, in 2003, very few visits are level one. Again, those are like those very quick visits. Most visits were level three, where you go in, you talk to the doctor for a little bit, you get what you need, and you leave. But since 2003, look at the green bar. That's level four visits. The percent of healthcare visits that are level four has consistently increased and just about doubled from 2003 to 2021, which means the cost of the visit has increased because those are more intense visits. Um, Another reason healthcare got more, we on the population level, we have more expenditures for healthcare because we have more people, right? So right now we have about 338 million people. It's estimated that we'll have 341 million people by 2027. Not only do we have more people, but they're getting older. So if we look at the population pyramids are cool because they can show us the age and gender structure of the population. So you can see in 2010, baby boomers are in their 40s and 50, 40, really 45 to 54, right? So we have a lot of middle-aged people, fewer people at the top. By 2020, we're starting to look more of a rectangle. As the baby boomers age and survive, we've got more older people. By 2030, estimated even more so. By 2040, we have almost as many people at the top of the pyramid as we do at the bottom. So our population as a whole is getting older. Finally, and this is my favorite, part of the reason health expenditures are so high is because we pay executives a lot of money. So in 2018, here's the compensation for health insurance company CEOs. 21 million, 19 million, 27 million, 8 million. Oh, you missed out. 21 million, 21 million. That's a lot of health insurance premiums. Just for 2022, again, for your consideration, anywhere between 13 and 22 million per year. And if we look at the cumulative total CEO compensation in the last 10 years, Cigna paid out in the last 10 years $365 million in salaries to one person, to their CEO. This is part of why our healthcare is so expensive. And it's not just health insurance companies. If we look at the CEO of for-profit hospitals, um, Universal Health Services, 51 million, 23 million, 17 million. You get the idea. Physician salaries. Physician salaries are higher in the US than they are in other countries. Um, Primary care providers make about 260,000 a year. Specialists make about 368,000 a year. There's a lot of variation in that, both geographic and by type of specialty, but these are the averages. Um, and finally, there's some other reasons. Like, why are we spending more? Healthcare is not a free market good, and that results in both too much use and not enough appropriate use because there's a lack of transparency about cost and quality. The healthcare legal environment. The US is a litigious society, so providers have to have malpractice insurance. And in addition to that, the claims get paid out. We have fraud and abuse. There are some spectacular Medicare and Medicaid frauds happening, and then clinical specializations. Um, so let's look at it from the individual viewpoint, right? What comes from your wallet? So when we think, we just finished talking about this huge pool of money, but how, from the individual perspective, do we pay for care? So about half of us pay for care from employer-based insurance. Um, about 6% of us directly purchase private health insurance from the exchanges. About 20% of populations on Medicaid, about 14% on Medicare, about 1% gets their insurance from the military, and about 9% are uninsured. And this varies a little bit. Currently, there's, I think, slightly more people on Medicaid and Medicare. I think uninsured rate went down to 7%, but it bounces back and forth. But this is roughly where we're at with what comes from our wallets and how we pay for it. Medicare, 97% of people age 65 and older are eligible for Medicare, and 11% are also on Medicaid. They're called dually enrolled dual eligibles. 35% also have private Medigap insurance because remember, Medicare has copays and deductibles. And so a lot of folks buy insurance to cover that. And only about 1% of folks age 65 and over are uninsured. How do we compare to other countries? Not really well. So looking at 2021 data, we spent $12,900 per person. Now we're up to almost 15,000 per person. The next one down spent a little more than half of that. Germany, Switzerland, Netherlands. Everybody else is spending less on healthcare than we are. And the question is, are we getting our money's worth? Nope, because we spend more per person on healthcare than any other high income nation, but we have lower life expectancy, higher rates of chronic conditions, higher rates of obesity, and higher rates of infant mortality. So we're not getting our money's worth, but we are spending more. And that is essentially it for our lecture on financing. Next time, we'll talk about insurance and how insurance works in the United States.